What this study is a look through a registry called the Mars Registry of patients with Morquio syndrome at the safety of the drug therapy that we have for Morquio A, which is called elosulfase alpha. In the registry now we have over 300 patients with the rare disorder Morquio A, and about 250, a little more, of those are on elosulfase alpha. So we had the opportunity to look and see what types of adverse events these patients are experiencing over time, and what drug-related events they may be experiencing. And what we found was that yes, a significant fraction of the patients have experienced adverse events during the course of the study, but many, if not most of those, are ones that are really related to the disease itself. So patients have experienced musculoskeletal complications, which we know to be a feature of Morquio A. They've had surgical procedures for orthopedic issues, spinal cord instability and compression, things of that nature, and then of course all the other adverse events that happen to people over the course of several years, things that are completely unrelated to either the disease or the therapy. But we did have about 8.8% of patients who had a drug-related adverse event during the course of the study, and these were generally mild to moderate. The most common one was urticaria, or hives, which we know can be a reaction to enzyme replacement therapy occurring during the infusions that are given. But it's important to note, and I think very reassuring, that there wasn't a single patient who had to permanently discontinue therapy because they weren't able to tolerate it because of drug-related reactions. So there were no new safety issues identified in this real-world study of elosulfase alpha as compared to the ones that were observed during the original clinical trials. We did see infusion reactions. We expect that in any protein therapeutics. But generally, as I mentioned, they were mild to moderate. Most of the adverse events that were cataloged during the course of the patient's time in the registry were really disease-related ones. I mean, the take-home message is very reassuring that the drug is safe and can be administered safely in the real-world setting, that most patients tolerate it well, with the adverse events that did occur being relatively infrequent and typically mild to moderate, and that there will be an extraordinarily rare patient, if there are any patients at all, who just cannot tolerate the therapy and have to discontinue. We had no patients like that. That's very reassuring that the drug is safe and well tolerated in clinical practice.